Hello, my name is Gerald Lewis. I'm a general physician and a cardiologist, and along with my wife Monica, we're doing a series of health talks available on the web. We both graduated from Otago Medical School in Dunedin in New Zealand in 1967, and over the next 40 years, we've both come to realize that there's a great deal more to treating our patients than just the drugs and the operations we learnt in medical school. And so we're doing a series of talks. Here's a list of some of them. And tonight's talk we're going to talk about will be diabetes. I've actually got some notes on this and many other diseases on my website, which if you want to have a look at, you're welcome to go and have a look at. It's down the bottom right-hand corner there. So diabetes mellitus. What is it? The size of the problem? Why do we get it? What can we do about it? How can it be eliminated? And unfortunately, it's not going to be eliminated the way we're doing it in medicine today. Modern medicine has incredible things. We're doing magnificent work in all sorts of fields, but unfortunately with diabetes we're falling very, very short. Why is it called mellitus? Diabetes means a siphon or a fountain. That's because diabetics pass a lot of urine. And there are two conditions which make people pass a lot of urine. First is a disease in the pituitary gland, diabetes insipidus, and another disease is a disease of the pancreas, diabetes mellitus. Diabetes mellitus is sweet, diabetes insipidus is insipid. Now, the two men who discovered the cause of diabetes, Mering and Milowski, they actually discovered it by removing the pancreas from some poor unfortunate dog. And then, believe it or not, they noticed that the urine smelt and tasted like honey. Yes, they actually tasted the urine and it tasted like honey. So basically this dog, when you remove the pancreas, passed urine that tasted very, very sweet. And to be honest, for many years, doctors used to diagnose diabetes mellitus by actually tasting their patient's urine. And in fact, when we graduated as medical school, I'm not sure it was essential, but nevertheless, it was part of the training that we had at medical school as well. So, if it's insipid, if it's sour, it's diabetes insipidus, and you've got a disease of the pituitary gland. If it's sweet and nice, it's diabetes mellitus. However, most of us, in fact, don't have any intention of desiring to taste the urine. Unfortunately, these days we've got little dipsticks which you stick in the urine, and that tells us if the patient's urine is sweet or sour. How big's the problem? The problem is epidemic. It is huge. In the past 5 years, it's interesting, so this has risen over 50%. 5 years, a 50% increase in diabetes. 1997, it was the 10th cause of death. 2009, number 5, and this year it'll be number 1. And it's going up exponentially. If you look at the countries where it's involved, the red is the most involved, then the orange, and then the yellow. It's a worldwide epidemic, not just, unfortunately, in the developed countries, but also the underdeveloped countries. And despite the advertising, the education, the money being spent on diabetes, we are not winning at all. In fact, if you look at that graph on the left, we're actually losing hands down. The Centre for Disease Control in the States calculates that 1 in 3 children born in the year 2000 and beyond will develop diabetes in their lifetime. 1 in 3. It's hard. It says in the Centre newsletter, it says it's hard to imagine these children living much beyond 40 or 50 years without developing diabetic complications that result in strokes, heart attack, blindness, or kidney disease. And they're talking about our children and our grandchildren. That's going to happen unless we do something about it, which is why I think this talk is very, very important. How do we get diabetes? Well, there are 2 types of diabetes, and the way we get it is different for each of them. Type 1 diabetes is childhood or adult or early adult diabetes, and basically these are the kids who need to inject themselves with insulin. And type 2 is obesity and caused diabetes. It used to be called adult onset diabetes, but now is beginning to affect children a lot more. It used to be just fat adults. Now it's affecting children and teens. In fact, if you look at this graph, it's interesting. The red, in 1980, nearly all type 2 diabetics were adults. 2010, the red are the adults. The bluish colour are children. And as you can see, in 2010, far more children were in fact suffering from type 2 diabetes than adults. So let's just stop for a second and work out the basic underlying causes of diabetes and what's happening in our bodies. How do sugars get into our body? What happens after we eat some sugary food? Well, we put the food in our mouth, open our mouth, and then goes the food, and we chew it. And as you can see, there's a lot of saliva there. The saliva actually starts dissolving the food, and it's very, very important to chew your food well, because that saliva begins to break down the food. I remember my mother used to say, masticate your food with your saliva. You then swallow it down the esophagus, down into the stomach, where the food is then affected by incredibly powerful hydrochloric acid, pepsins, gastrins, and other things which basically dissolve it even further, breaking up the food into smaller and smaller and smaller particles. It then passes on through the stomach, often spends about a few minutes to hours in the stomach, depending on the type of food, then through into the duodenum, which is a completely different milieu with alkaline, and juices from the pancreas and the bile by the gallbladder come, and that further dissolves the food, which then passes down on into our small intestines. Small intestines are quite incredible. As you look at the small intestines, they are amazing. Let's open up the small intestine and have a look, and you can see it's not just a tube, but there are lots and lots of little finger-like projections. As we come closer and closer, you can see these little finger-like projections coming out like that. These are called microvilli, and the little yellow spots are glucose, sugars, going into the bloodstream, and that's how sugar gets into our bloodstream. It's broken down in the saliva, the stomach, duodenum, and then is absorbed in the small intestines. Now, glucose can't get into our body cells by itself. It needs insulin to get in. Glucose, the yellow, cannot get into our cells without insulin helping it. Insulin comes from the pancreas gland. It opens the glucose doors in the cells. So on the right-hand side there we've got a muscle cell, and there's a door, and glucose can't get through that door into the cell without insulin. Insulin comes along, unlocks the door, opens the door, and that allows the glucose to get in. Without insulin, the glucose cannot get into our cells. Now, insulin is made of the pancreas gland, which sits there in the duodenum, and it's made in the islets of Langerhans, which are those little blue cells surrounding the blood vessels inside the pancreas. These little islets detect the glucose, the yellow spots in the blood, as it goes past the little islets, and it creates the right amount of insulin needed to open the right number of doors to keep the blood glucose level in the normal level. So basically, as the blood glucose goes up, insulin is secreted, and the sugar glucose comes down. So basically, you keep the glucose in the right level. In diabetes, the system goes wrong. Type 1 diabetes is juvenile diabetes. And what happens in type 1 diabetes is the insulin-secreting cells in the pancreas are destroyed. They're the little blue cells. Instead of being blue, they are destroyed. They're dead. What happens is our immune system identifies, which is made to identify invaders and kill them. We've got a wonderful immune system. There are little immune cells there. And those are bacteria coming into the body. Immune cells come out like that, and they basically attack the bacteria. The macrophages destroy and kill the bacteria. And that's the way our immune system is designed to work. Something foreign comes in, our body's immune system goes out and destroys it. In type 1 diabetes, the immune cells think that the islet cells, the blue cells, are invaders, and for some reason they destroy them. Now, what happens in type 1 diabetes is the pancreas, because the cells have been destroyed, makes no insulin, and the blood sugar shoots up, stays up, because there's no insulin to open the doors, and the sugar just goes round and round and round until it's taken away in the urine or by the liver. So what destroys the islet cells? And there are a number of theories. We're still not exactly certain about it. One is A1 milk, two is virus infections, genetic inheritance, and there's no doubt people are more prone to it, and of course there may well be other things as well. Could the milk that our children drink be causing diabetes? Now, some cows make milk called A1 milk, and other cows make milk called A2 milk, and you can't tell the difference, although basically the Asian and African cows tend to produce more A2 milk. A1 milk and A2 milk are absolutely identical, except for an A1 beta-catein and an A2 beta-casein, which is different by basically one little cell there. There's an A instead of a C in A1 and A2. Now, worldwide, there's an association between A1 milk consumption and diabetes. This author here, in fact, plotted A1 milk consumptions against diabetes in many countries, and as you can see, it's an extremely close association. The more A1 milk that was drunk, the higher the incidence of diabetes. So how on earth could drinking cow's milk cause diabetes? Well, the reason is that A1 milk can be broken down and A2 milk can't. In the gut, A1 milk is split into two proteins, and one of those proteins is similar to the islets of Langerhans cells. And so what happens is our immune system sees these cells. It produces an immune reaction to the milk, and then goes in that immune reaction, unfortunately, then destroys our islets of Langerhans cells in the pancreas. So the answer is very simple. Drink A2 milk. It tastes exactly the same, and I think basically what we should be doing is encouraging our big milk companies to produce A2 milk. All baby formula should be A2. It's absolutely criminal that we have the ability to, in fact, provide A2 milk and not give it to all of our babies. Drinking goat's milk or children, we're just talking about children in this situation, drinking goat's milk or sheep's milk, and you should breastfeed for as long as possible. In the States, they did a study, and children fed cow's milk had 11.3 times the risk of developing diabetes of those children who were breastfed for at least 3 months. Just look at those figures, 11 times the incidence if you didn't breastfeed. The second way of cause is virus infections. Viruses produce antibodies, rubella, mumps, measles, Coxsackie, and these may also destroy the pancreas. So if a child has an infection or vaccination, my suggestion would be at the time of the infection or just before vaccination, take plenty of vitamin C, which helps make the immune reaction much more specific, and avoid drinking milk or milk products at the time of both the vaccination or having a virus infection. That's type 1. Now, type 2 diabetes is a very different disease in its cause, but the effects are almost identical. It's got plenty of insulin, but the cells are resistant to it. It used to be in overweight adults, but now it's affecting our kids as well because we're getting overweight children. And as I said, the CDC says 1 in 3 of our children is going to develop diabetes now, unless we do something about it. And the exciting thing, and the tragic thing, is it's 95% preventable. Type 2 diabetes is caused by a high sugar intake. Now sugars, we all know about sugars, but sugars in our bodies and sugars in plants and in animals aren't just individual sugars, they're joined together as starches. So that sugar on the left-hand side joins together to form a starch. So that starch on the right-hand side has got 3 sugars inside it. And these starches can either be in a single strand on the left, or they can be branching strands on the right-hand side. That makes a huge difference whether they're branching or whether they're a single strand. In the intestines, as I said, the starch has got to be broken down into single sugars before it's absorbed in the intestines. And the single strand is amylose, and the branching strands are called amylopectins. Now, when these sugars are broken down, only the end sugar, the sugar away from the little black spot, only the end sugar can be removed one at a time. So basically in amylose, there's only one. In amylopectin, there's lots and lots and lots. So when it's broken, so that's why some sugars spike the blood sugar levels. These have got a high glycemic index, and others don't. Amylose on the left-hand side, only one comes off at a time, and then the next, and the next, and the next. So it's basically the sugars only rise slowly, and that's a low glycemic index. Amylopectins, the branching sugars, all come off together like that, and it more rapidly is absorbed, and you get these high spiking peaks. And those are sugars that have got a high glycemic index. It has nothing to do with most anything else other than the shape of the starch. Now, high glycemic foods make high peaks in the blood sugar followed by a high insulin result. So basically, with the branching sugars, you get a high peak, high sugar, high insulin, and then often it overshoots below. With the single strands, you just get nice, gentle insulins, and your glucose is rising like that, and it never leaves the normal range. Now, the important thing is the overshoot. The yellow sugar going below the line means that you feel hungry. So basically, people who eat high glycemic sugars often get hungry shortly after they've eaten the sugars. So high glycemic foods are the major cause of diabetes, and there's a list of the high glycemic ones and a list of the lower glycemic ones there. Now, persisting high sugars and high insulins lead to something called insulin resistant. Just like our noses get used to a background smell, if you walk into a place where there's an unpleasant smell or a smell, after a while your nose gets used to it. If you go to a place where there's a background noise, after a while your body gets used to the background noise and it tends to ignore it. Well, insulin receptors get used to high insulin and they stop working the normal way, and the insulin receptors no longer open the glucose doors. So the doors stay shut. So what happens in type 2 diabetes is the glucose receptors don't respond to the insulin. So we get high levels of insulin to try and open those doors, and the glucose in the bloodstream also rises. The glucose attaches onto the cell walls and it weakens them. It's called glycolysis, and that damages the cells, and that causes a lot of the problems associated with diabetes. The other thing is that insulin also damages the artery walls and causes inflammation, which also attacks our cells. So in diabetes you get a double wham. You get both high insulin damaging and you get high glucose also damaging. So let's just summarize that briefly. When we eat sugars, they're broken down into glucose. That goes to the pancreas, which then secretes insulin. The pancreas releases the insulin, which opens the gates and allows the sugar to enter into our bloodstream. Insulin unlocks the doors, and you need both insulin and glucose. And the body produces just enough insulin to make sure the blood level is just about right. In patients with type 1 diabetes, the insulin production stops completely. There is no insulin, so basically the doors stay shut and the glucose level in the bloodstream rises and rises and rises. In type 2 diabetes, there's insulin resistance. The cells are used to high insulin, and so basically the insulin doesn't work. The insulin can't unlock the doors, so basically in the bloodstream you've got more insulin and you've got more glucose passing through the bloodstream, still doing damage. And the glucose attacks the proteins and the cell membranes, and so instead of having healthy cells and healthy blood vessel walls, we get damaged cells, damaged blood vessel walls, and that causes the damage, and that causes the problems with diabetes. Insulin and glucose, high levels, affects all of our bodies. Diabetes is a terrible disease. Don't let everybody say it's only mild and it's not too bad. It's a terrible disease. It increases the risk of heart attack, angina, and heart failure. It causes stroke. It causes kidney failure. The major cause of kidney failure these days in most countries is diabetes. Gangrene with amputation, Alzheimer's disease, all of these caused by diabetes, and blindness. Have a look at that eye there. That's a diabetic eye, and you can understand why these patients go blind. These don't need to happen, but they are happening in millions and millions of people all around the world. Type 2 diabetes is 95% preventable. It can be stopped and it can be reversed, but that's not happening with modern treatments. Modern treatments, if you're overweight, lose weight. The question is, how do you do that? The diet that basically diabetics are told to use is low saturated and concentrated sweets, but they don't actually tell you what you can eat. Regular exercise is recommended, not smoking, monitor the blood sugar levels, although the evidence for that being beneficial is not all that high. And we've got drugs, sulfonylureas like glycoside, glipizide. These increase the weight, and in actual fact they increase the rate of death, even though they do control the blood sugar. Metformin you can't give to patients in heart failure or patients with kidney disease. A number of the newer drugs like Avandia increase the weight, increase heart disease, and increase liver disease. So basically modern medicine is not doing very well at all. Most don't increase life expectancy or reverse the disease. All they're doing is controlling the blood sugar. The answer, however, is so easy and cheap, and you just wonder why we're not doing it in every diabetic. First of all, let's just get the seriously overweight people away, sorted out. If you're seriously overweight and you can't lose weight no matter how hard you try, gastric bypass surgery is absolutely incredible. It makes people lose weight hugely, but the other thing is it can cure diabetes. And we've discovered now that the fundus of the stomach secretes a hormone called incretin, which actually blocks the effect of insulin. And by removing part of the stomach or bypassing the stomach, you actually drop the incretins, and the diabetic control is much better. So people who are severely overweight, gastric bypass is without a doubt the treatment of choice. But for most people, the answer is to eat mostly low GI food, eat lots of fiber in the diet, exercise, nutritional supplements, reducing stress, and improving sleep. That's it. Too easy? Well, it actually works. Let's go through these one at a time. If we eat mostly low GI food, it keeps the blood sugar and the insulin levels smooth and low all day. So basically the insulin receptors never get tired and you don't get insulin resistant. If we eat high glycemic breakfast, lunch and dinner, what happens is the blood sugar shoots up and down, you get hungry, up and down like that, And when it's up high, eventually that leads to insulin resistance. And when it's low, we feel hungry, so we eat more than we should do. So we need to eat low GI as much as possible. Replace refined with whole grains. Whole grains take longer to absorb, so basically it's much better to eat whole grains if you can. Eat several small meals and snacks per day, not just 3 huge meals. Eat calmly and chew your food, so the amylases, so the saliva juices start dissolving it. And eat the larger meal early in the day and make the evening meal just a small one. We all eat the large meal in the end of the day. When we relax, we don't get rid of it with exercise. Soft drinks increase the diabetic risk. In the Boston Nurses study, they studied 91,000 nurses over the years. Women who drank greater than 1 soda per day were 85% more likely to develop type 2 diabetes than those who did not. Soft drinks are bad news. Don't give our kids soft drinks. In fact, it's important. We should let our children know what drinking lovely water is. Get pure, clean, cool, crisp water and let them enjoy that rather than soft drinks. Number 2 is eat lots of fiber in our diet. Fiber in the diet slows down sugar absorption. They did a study where they actually looked at blood sugars and they were halved if fiber is eaten with low GI foods. So basically here's the blood sugar with high GI foods taken with fiber, and the blood sugar level drops simply because the fiber is there with it. Number 3 is regular daily exercise. Exercise does all the right things for diabetics. It increases the cell's sensitivity to insulin, gets rid of insulin resistance. It reduces the need for drugs. It improves the cholesterol and the triglycerides, and it reduces weight. Exercise is important, but make sure the exercise you do is fun. Don't do an exercise that you hate doing so it feels like purgatory. Find an exercise that you enjoy. Find a dog that you want to walk, and enjoy your exercise. Nutritional supplements is something that Monica and I are very strong about, and I think it's very important, and sadly our medical colleagues tend to ignore them. Diabetic cells need perfect nutrition. All of the cells, the damage of the cells on the right hand side, they need perfect nutrition because they can recover. All of the diabetic diseases benefit from optimal nutrition, and most people, as we know, eat an imperfect diet. Absorption can also be poor in diabetics, so even if you are eating a good diet, you probably need to supplement as well. They need to take a good multivitamin, multimineral, antioxidant, fish oils, and extra vitamin D. Does it work? Well, just have a look at the medical literature. There's a lot of good research showing that nutritional supplements help in diabetes, and it's information that we doctors ignore. Multivitamins reduce infections. 130 diabetics given multivitamins or dummies. This is a study in the American Journal of Internal Medicine. Dummy patients, 93% had infections. Those taking multivitamins, 17%. Look at the difference. Vitamin B vitamins reduce glycosylation, which is what damages the cells. B6 reduces the nerve damage associated with diabetes. Niacin improves the blood glucose control. Vitamin C reduces inflammation, inhibits glycosylation, reduces the eye damage, and is absolutely essential for wound healing. Vitamin E improves insulin sensitivity, reduces protein damage by glycosylation, improves kidney function, and reduce eye vessel damage. Vitamin D increases the insulin production from the pancreas, reduces the insulin resistance, reduces inflammation, and improves the action of insulin. All these vitamins help diabetic control and or reduce the complications associated with them. Minerals. Manganese helps the glucose metabolism. Zinc is essential for wound healing. Chromium enhances glucose. Magnesium uptake. Magnesium, calcium, selenium, boron, all the important minerals do have an effect on diabetes. They did a study, well, they noticed in hospitals when patients were in intensive care, when they were being fed by drips, they weren't eating any food at all, they were giving them parenteral nutrition, they all developed diabetes until they discovered that there was no chromium in the food they were giving them. Adding chromium to the drips and the diabetes stopped. A little bit of chromium is absolutely essential. So we don't know which minerals you need, therefore you need to take a good multi that's got all the minerals you need. Number 5 is reduce stress and improve sleep. Now, stress releases 2 hormones, adrenaline and cortisol. Adrenaline raises our blood sugar, cortisol raises the blood sugar and the blood fats. And we create those adrenaline and cortisol in times of stress. From caveman time, We needed the adrenaline basically to help us run in the fight and flight reaction, and the cortisol also helped us in the fight and flight situation. But then the cavemen went back to their cave and they relaxed, and the cortisol and the adrenaline levels went back to normal. We need to learn to relax. We need to learn how to meditate. We need to relax properly. We need to go into the equivalent of our caves so that we can, in fact, get our cortisol and adrenaline levels back to the normal levels. Sleep's especially important in diabetics. Now, people tend to sort of poo-poo sleep a little bit, although it's very, very important. In diabetes, it's important because melatonin is a hormone which puts us to sleep. It's produced by the pineal gland, that little green thing right there in the middle of the brain, the third eye. And what melatonin does is it affects insulin production. It affects the insulin resistance, and it also increases leptin. Leptin is a hormone that is created by our fat cells to tell us when we are satisfied. And the reason you don't get hungry at night is because you produce leptin. Is because the melatonin increases the leptin, so you don't feel hungry, so you don't have to get up and have a midnight snack. So we should be aiming for 7 to 8 hours of sleep every night. You need to sleep in total darkness. If it's not totally dark, especially no blue lights, if it's not totally dark, you don't create the same amount of melatonin, and you need to relax before going to sleep. Whether it's beneficial to take supplemental melatonin, we really don't know. Now, we can halt the diabetic epidemic, which threatens our children, at minimal cost, with no side effects, proven to work, improve the quality of life, eating mostly low GI food, lots of fiber in the diet, exercise, nutritional supplements, and reducing stress and improving sleep. And anybody, but anybody, can do that. Now, Monica was going to give the rest of this talk, but she's not here at the moment, so I'll be doing the rest of the talk. She'll do another one later on with in it. So I'll do her talk now. This sounds easy. Anybody could do it. Does it work? Now, Monica had a patient called Sarah. She had diabetes since she was age of 10. She's now 32. She's got 2 young children, and her husband has left her. She's got very poor circulation to the leg, which is a blockage. This is not her arteriogram, but it's similar to that. She's had bypass surgery to the leg, which was unsuccessful. And she had leg pain at night. She had pain walking 15 meters. She could do almost nothing. And the doctors basically said, the only thing we can offer you is amputation. Conventional medicine couldn't help. She had no more operations and no drugs were helping. And Monica suggested, before you amputate, let's try some other treatments and see if they work. So she gave her low glycemic foods, supplements, multi, selenium, coenzyme Q10, fish oil, ginkgo biloba, which has actually been shown to improve the circulation, calcium and magnesium, counseling, a little bit of exercise, and she also had chelation therapy intravenously to help remove the heavy metals. Now, remember when she started, she got leg pain at night and she could only walk 15 meters. After 4 weeks, she had no night pain and could walk to her mother's house 400 meters down the street. And 2 months after that, Monica received an excited phone call. Guess where I am? I've just spent 3 hours walking around the Christchurch Museum with my children. And all the doctors had previously offered her was amputation. We can make a difference with simple treatments. Now, Monica had been searching on how her patients can do those various treatments, low GI, fiber, exercise, nutritional supplements, and reducing stress. And she'd used supplements and recommended supplements in the past, but to be honest, with relatively little benefit. Then she discovered a book that showed there was an enormous difference in the quality and particularly the contents and the production of various supplements. And this book, written by Lyle McWilliams, called The Comparative Guide to Nutritional Supplements, is an international book where they had international experts deciding on what is the ideal supplement, and they also analyzed the quality of the supplements. And the 5 top products rated out of 5, USANA Health Sciences, Douglas Laboratories, Thorne, Extend Life, Nature's Way, and Axis. And they're the 5 top products. Now, in New Zealand, the one most easy to get hold of was USANA Health Sciences, so Monica decided to try using that one. But I suspect the same results would be obtained if you use the other ones as well. So Monica tried USANA for herself, for her arthritis. In fact, Monica had a skiing accident. This was somebody else, this wasn't Monica, hit Monica, crashed Monica over, and she, in fact, became quite seriously ill and has to be taken down the hill by one of these little goonies. And it caused arthritis all over her body, and Monica really was quite unwell for a long time, and she was quite scared that she was going to be turned prematurely into an old lady, able to do almost nothing. And then what happened? When she treated herself with quality supplements, is in fact suddenly she discovered she was able to do a lot more. She was able to climb down to the bottom of that canyon. She's able to canoe with me. She's not very good at canoeing, but nevertheless she canoes with me. And basically she has turned from the equivalent of an old lady to a much more healthy person simply by taking good nutritional supplements and looking after herself. And her patients saw the improvement, and they wanted whatever Monica was taking. And soon Monica's rooms were so full that in fact she had to close her books and retire. So Monica used USANA supplements for her diabetic patients. First of all, that provided them with quality nutritional supplements. USANA also makes low glycemic shakes and bars and fiber drinks, so that helped with the low GI food and lots of fiber in the diet, particularly the fiber. I think fiber is something we underestimate, and it's important people take regular fiber. She learned counseling at medical school, and she encouraged her patients to meditate and exercise. So basically, with the addition of USANA, the USANA products, and these various things, she was able to do all the 5 things required to help treat diabetes properly. So her approach to type 2 diabetic patients, which of course is my approach too, is 1, counsel and address the stressors, encourage meditation and relaxation, have a good night's sleep at night, every single night. Exercise every day for at least 30 to 45 minutes every day. Start top quality nutritional supplements, a multi, fish oils, calcium and magnesium, coenzyme Q10, which is important for energy, and extra vitamin D, which we're now appreciating is very, very important. Nutritional intake is crucial. Now, USANA makes a product, we need to reset the insulin receptors by a low glycemic, high fiber diet. And USANA have got a 5-day reset plan, which Monica's been using with incredible success. What it means is you can actually take somebody and give them a 5-day cleanse reset, which resets all the system and also gets rid of some of the insulin resistance. They've got low glycemic, high fiber shakes and bars, meals for snacks and selected foods. And in that box you have all the food that you take other than the water for all 5 days. Drink lots of water, 1 to 2 litres a day, and walk 20 to 30 minutes every day. So that's the beginning. Diabetic comes in. That's how Monica starts, with resetting. Then the transform stage, which can be repeated depending on how often you want to, how successful it's been. You have shakes for 2 meals, 1 low GI meal, and bars and shakes as snacks between. Then the maintaining, which is good eating for the rest of our lives. Low GI food diet, shakes and bars, fruit, vegetables and nuts. The food looks appealing, it is appealing. And basically good food for diabetic patients actually is very much nicer than a lot of this fast food that we tend to eat. Now people say low GI eating is hard, but the answer is it's very easy. Let's look at a few possible rules and how it can be done. Number 1 is eat frequent small meals. We should graze, we shouldn't have huge amounts. Now, Okinawa, people in Okinawa with the longest livers, they have the longest livers, they lived longest on the planet. They have a high green, yellow vegetable and low carbohydrate intake, but importantly, they only ate 80% of whatever was on their plate. No matter how little was there, they only ate 80% of it, and they lived longer than anybody else on the planet. We need to make most of the food that we eat low glycemic. Now, we're creating a little booklet of low glycemic food because it's actually quite hard to find, but you can Google low glycemia and have a look at that as well. But eat mostly low glycemic foods. And it's easy. Breakfast, fruit, cherries, grapefruit, apples, pears, plums, oranges, grapes. Cereal, all bland, porridge with milk or yogurt. Bread or toast, Bergen bread, soy or linseed, mixed grains, multigrains, ploughmans, whole grains. All of those are in fact low glycemic. Eggs, poached, boiled, scrambled, or an omelette. Now that is not a bad breakfast, not altogether, but basically those are things that you can choose from for breakfast. For lunch, sandwich on low GI bread, cheese and tomatoes on bread, green salad with grainy bread, cheese, egg, chicken, ham, salad, salmon, lots of vegetables and lots of fruit. And for dinner, steak, chicken, fish, salads, stir-frieds. I'm getting quite hungry. Casseroles, barbecue, lots of vegetables, some eggs, nuts, grains, legumes, desserts. Look at this. Ice cream, low GI fruit, low GI fruit salad, apple pie or strudel, fruit jelly, ice creams. All of those, believe it or not, are low GI. And between meals, you can have snacks of apples, apricots, cherries, oranges, sultanas, nuts, ice creams on the cone, milkshakes, pita bread and marmite, 2 slices of heavy raisin toast, low-fat yogurt, oatmeal biscuits, and Usana also makes a number of snacks and bars which you can use as well. And I would think that would personally satisfy most adults and most children very well. Grazing throughout the day allows the body to digest food properly, and also you don't get the high peaks. You've got on less weight and it's healthier. So we can beat diabetes so easily and so cheaply. And diabetes has got no favourites. Anybody can get it. Halle Berry has diabetes. Larry King has diabetes. Mary Tyler Moore, I can still remember the Mary Tyler Moore show when I was a lot younger than I am at the moment. She developed diabetes, type 2 diabetes at the age of 20, but she's still well at 70 because she's looked after herself. Drugs don't treat the disease. The effects of diabetes are so horrific. We need to look at ways that work, that will treat the disease. And it's important to realize that it's worth spending time doing it, because if we don't, we will suffer the consequences. And now it's threatening our children and our grandchildren. And these are my children, two of my children, and 4 of my grandchildren. But our children can't afford to wait. If we don't act, 1 in 3 are going to develop diabetes. They'll have accelerated heart disease, strokes, amputation, kidney failure, and blindness. We can sit by, as we're currently doing, and allow this to happen, or we can take these simple, cheap steps, which will not only reduce the risk of diabetes, but also heart disease and cancer. Low glycemic foods, high in fiber, moderate exercise, nutritional supplements, stress, and sleep. That's all. So we can offer our children disease or health. That's our choice, and that's going to be our legacy to our children.